Intellectual impairment represents a deficiency in thinking ability, which limits adaptive behavior normally reflected in maturation, learning, or social adjustment. Fragile X syndrome is the most common inherited form of mental retardation, associated with intellectual and emotional disabilities ranging from learning problems to mental retardation and mood instability to autism. Emory University has been and continues to be at the forefront of human genetics research. The university's Department of Human Genetics was founded in 2001 as a part of the Emory University School of Medicine. Emory University in Atlanta is the nation's largest Fragile X research program, one that has mapped out the molecular and clinical consequences of the Fragile X gene mutation. How would you diagnose a patient with Fragile X syndrome?
The diagnosis can come about in a couple of different ways. Sometimes the child's pediatrician would notice that they may be not developing as quickly as typical children, and then they might notice certain facial features about the child. Kids with Fragile X syndrome tend to have a longish face and ears that might be a little bit more prominent or stick out a little bit than other kids. And then they can order a genetic test for the syndrome. Other kids, they don't look a particular way. They don't look strikingly different than other children, and they may just have Fragile X syndrome genetic testing as a let's just see if anything's going on with that. But really, it comes down to a genetic test.
What is the disorder, and how does it affect the body?
The disorder is caused by the fact that one particular gene, the Fragile X gene, gets shut off. And it causes the brain to develop a little bit abnormally. The nerve cells in the brain can't talk to each other the way they normally would, and that causes children to be intellectually impaired. So the term used to be mental retardation, but now we use the term intellectual impairment. So they can't learn as well as other children. They learn more slowly than other children, and they tend to have features of autism.
What are the symptoms of Fragile X?
Really, it comes down to the key feature being the intellectual impairment. These kids just really have trouble learning at the same speed as other children, and they have trouble with some of what we call higher order functioning. So they have trouble, if you had a list of things to do, other children would be able to plan how to go about checking all those things off a list. A kid with Fragile X syndrome really can't think at that higher planning level. So an example that I've heard given before is if you had 3 errands to run, go to the grocery store, go to the bank, go to the post office, you could figure out, okay, well, I'll go to the closest one and then, drive to the next one, drive to the next one. People with Fragile X syndrome, they kind of need to go to the post office, go home, go to the bank, go home, go to the grocery store, go home, because they just can't figure out how to do all those complex tasks that we take for granted. They also really tend to not like new situations, so meeting new people, going to new places, and that's part of the autistic features of Fragile X.
What is the typical lifespan and quality of life of an individual with this disorder?
People with Fragile X syndrome have a typical lifespan in general, although people with intellectual impairment and general social problems and autistic features tend to be more prone to dying of accidents. So kids with Fragile X syndrome might die of an accidental drowning or something like that, but it's not something about their disease that necessarily kills them other than the fact that they might not be able to normally function and avoid risks as well as other normal people.
What current treatments are available, and what can a person do to prevent the condition from appearing?
treatments for Fragile X are not very good at this point. We tend to give them drugs that will perhaps modify some of their symptoms. So they might be on some of the same drugs that other people in the general population are on, such as anti-anxiety drugs, antidepressant drugs. They can have problems with hyperactivity, so they might be on the same kinds of drugs as children that have ADHD or something like that. But there are clinical trials in development, some being tested at Emory, that are aimed at really not curing Fragile X syndrome, but really targeting the problem, the loss of this one gene in Fragile X syndrome that might be a specific therapy that will help these people. In terms of preventing Fragile X syndrome from happening, it's a mutation that is found in a gene in these people. So there's really nothing that person could have done to prevent the condition in themselves. But Fragile X syndrome is the most common form of inherited intellectual impairment, so it runs in families. And so there are people called genetic counselors who can work with families that have Fragile X syndrome in them, and they can make reproductive decisions based on the fact that they know that this could run in their family. And so that can involve things like looking for the predisposing mutations in somebody when they're considering having a child, and they may then choose to not have children at all. Or they may want to know that their child's going to be affected before their child's born, and we can do tests to look at that. Or they may choose to use some of the artificial reproduction technologies that we have to avoid having an affected child. So really we're getting at family planning issues, not necessarily something that you can do in yourself to avoid getting Fragile X.
What is current research uncovering about prevention or cures?
Well, the clinical trials, the clinical drug trials that are going on right now are very exciting in the field. The drugs that have been developed that will hopefully help people with Fragile X syndrome, remember I said people with Fragile X, the nerves in their brain have trouble talking to each other properly. They have defects in the signals that are passed between the nerves. And people with Fragile X syndrome, basically the gene that is causing Fragile X syndrome, or the gene that's mutated in Fragile X syndrome, it serves as a brake to sort of shut off the conversation between nerves. And so if you don't have that brake, the talking between the nerves just keeps going on and on. And so this drug is designed to shut off that conversation, basically, so that it will stop the nerves from having that excessive chatter. And really they're in the phase of the clinical trial where they're just trying to see if it's safe, and they're only testing it in adults. The hope would be that you would give it to children as early as you could, and so they could maybe not be delayed as much relative to their peers. But we don't really know yet if it's going to help, or what symptoms of Fragile X syndrome it could possibly help.